strength, frequency, route of administration, and duration of treatment. So these 6 things have to be mentioned in case of inscription. The drug name has to be mentioned in capital letters and the inscription should be rational. They should not be unnecessary, contraindicated or teratogenic drugs. Teratogenic drugs should not be prescribed to pregnant patients or patients of reproductive age group female. If a teratogenic drug is prescribed to a reproductive age group female, appropriate contraception advice has to be given. If by chance you are forced to prescribe a teratogenic drug in such age group. Now I will give you an example. For example, for a diabetic patient, I want to prescribe metformin. So how I will prescribe? Tablet metformin 500 mg twice daily orally for 1 month. So I have included all 6 components: dosage form, drug name, strength, frequency, route of administration and duration of treatment. Now after inscription, the next part is subscription or instruction to the pharmacist. So there I can write dispense 30 such tablets. After subscription, the next is transcription, where I have to give instruction to the patient. So instructions to the patient can be of dietary advice, follow-up advice, investigations, or some instruction regarding side effect of the drug. So for example, in case of diabetes, I can give dietary advice that do not take high glycemic index food. So restrict intake of or no intake of sugar, rice, potato, banana, maida, biscuits, namkeen, etc. The next advice could be some investigation I want him to do. For example, I want him to do sugar charting twice daily. So monitor fasting, and you can write it in full: fasting and post prandial blood sugar twice daily using glucometer. As far as possible, we should avoid writing short forms in case of prescription because patients may not understand them. For example, I want the patient to do some investigations and come, so I can write do renal function test, do HbA1c, do fasting and postprandial blood sugar when I want them to do. So for example, I want him to do this after 25 days. Also, some advice regarding the side effect of drugs can be given. For example, if prazosin is prescribed, we can counsel the patient regarding the first dose hypotension, that he should take the drug after, just when he is about to sleep, and when he is getting up he should take some support. We can give advice regarding lithium. If lithium is prescribed, we can give advice regarding agranulocytosis, that stop the drug if WBC count falls below 4000 or absolute neutrophil count falls below a certain level. Then the last is signature. The doctor with the, also we can give follow-up advice, that follow up after 30 days. Also we can give advice regarding these to the patient. Signature of the doctor is the last with seal. Now seal should contain degree, name of the doctor, degree of the doctor, and registration number of the doctor. And if he is in a hospital, his designation can also be included in the seal. Now we will write a sample prescription and we will understand these points. For example, we have a diabetic, known diabetic, 40-year-old male, and he has come with a complaint of hypertension. He has come with a complaint of headache and intermittently, and BP is 160 by 90 mm of mercury. So how will we write a prescription for this patient? First we will write doctor's detail. For example, Dr. Swapnil Rai, MBBS, MD, ABC Hospital, Dilshad Garden, Delhi. Mobile number is 99988 and registration number. Then we write the date. So today's date we will mention. Then we will write patient details. For example, Mr. Ram Kumar, age 40 years, male, now his weight is 60 kg, registration number 123, address D33 Dilshad Garden, Delhi, phone number now the next is diagnosis. So you can write hypertension, in non-diabetic. So patient has come with intermittent headache. We don't need to provide an analgesic right now because this headache is most likely due to hypertension. So we will provide an antihypertensive drug to the patient. So RX superscription, then in comes the inscription. So for hypertension in a known diabetic, ACE inhibitors or angiotensin receptor blockers are the drug of choice as they retard the progression of diabetic nephropathy. So we will prescribe telmisartan tablet, telmisartan 40 milligram once daily orally for 15 days. When the patient has to take it after breakfast. Now you can give advice to the pharmacist. Dispense 15 such tablets. So while prescribing, we have to be careful that the drug we are prescribing is written in generic name and the drug name is written in capital letters. Writing in generic name is compulsory. Even if we want to write brand name, we have to mention generic name in brackets. Also, the prescription should be rational. For example, in hypertension with diabetes, we cannot prescribe thiazide diuretics as antihypertensives as they cause hyperglycemia. On the other hand, telmisartan is a good drug to be prescribed in such situation. Now, instruction to the patient. So you can give instructions regarding follow-up. That follow-up after 15 days. What the patient should do during these 15 days. Decrease salt intake, so low salt diet. Avoid oily and spicy food. So this is the dietary advice. If we want to do some investigations, like I want the patient to do BP charting, so do blood pressure charting twice daily after 15 minutes of rest. I want the patient to return with some investigation, for example, renal function test. Renal function test. So these are the advice for the patient. Now you have to sign the prescription, write the date and seal. Seal with name, degree and registration number. So this is how you write a prescription. I hope you have understood the topic of prescription writing, and thank you and have a nice day.